Hi everyone, how are you? I hope this finds you well. A recent video that I made, I referred to what is known as a personality disorder, and it is called borderline personality disorder. There are many examples of borderline personality disorder that we can think of off the top of our heads because it seems as if the YouTube platform is a magnet for those with personality disorders. It seems as if it is a new source of supply for narcissists. It is a new source of begging for those that believe that they deserve money that they haven't earned. And it serves as an overall endless supply of attention and adulation. And it's a 24/7 opportunity to some of these people that have never had even one person available to them at any hour. Since I mentioned borderline personality disorder, I wanted to talk a little bit more about it. I can't find my books on it. There's not a lot of information about borderline personality disorder, as it was a newer concept in the grand scheme of um, the field of psychology, if you will, and the leader in treatment protocol for borderline personality disorders is a lady called Marsha Linehan. Now, Marsha came up with the most of the information that's out there now. Clinicians have built upon her premise for treating those with borderline. Okay. I am not a therapist. I have never been one. I'm not a clinician of any kind. I am finishing my master's of forensic psychology. I've taken a break from that and I am finishing that up. I have a bachelor's degree in psychology and a bachelor's degree in criminal justice. So I read a lot of books. As I told you in the last video, I had to stop law school because I got sick, and I had to stop my nursing program as well in 1996 from that. So I have a background in that. I have treated many people in the hospital setting that have had mental health disorders, and I have shared that I survived my own suicide, and I spent 3 months in an inpatient psychiatric facility, and I have went through much therapy myself. With that being said, basic therapy and counseling, as most of us think of it, there's some very basic, just when you think of talk therapy, there's psychoanalyzation, and that's a whole different animal for very, very specific people who really practice and they really believe in Freud and in the analyzation of your thoughts and dreams. That's psychoanalyzation. That's a whole different thing. Your basic generic therapy for maybe a short-term problem would be in based in cognitive behavioral therapy, CBT, where it's not that deep. It's for a shorter term fix for something that is distressing for a period of time, not necessarily long term. All of those types of therapy that are pretty well known and accessible don't work with somebody with borderline personality disorder. As I stated, borderline personality disorder is on a spectrum, and I feel that the best comparison for it is as you think of somebody who has a diagnosis of autism, in that you may know family members that you suspect have a little bit of autism, and they just have some difficulties with relating to the rest of the family. You've always felt like something in them doesn't understand things in the ways that others do, and you have to maybe spend a little bit more time at the holidays making sure that that person doesn't get overwhelmed. If that makes any sense. So there, and then you can have somebody who through repeated failed relationships gets an adult diagnosis of autism, but they're highly successful. They've used their brain to accomplish things that a lot of people couldn't. And then you have people who cannot live on their own and have always needed care for their autism. Borderline personality disorder is that. It is a personality disorder that can be mild and managed to absolutely out of control. It used to be easier to explain before the DSM, the essential Bible of psychiatry, changed. It went through a lot of changes in its last revision to be more reflective and inclusive of the way that our society has evolved from what it once was. And you could break down a person's diagnosis a little bit better. I am not as well versed as I have been out of school for a few years, and just recently have decided to embark on picking up where I stopped and finishing up my master's in forensic psychology. Just a bunch of papers I got to write. But you know what? I've got a lot of inspiration lately, if you know what I mean. Wink, wink. So, as borderline personality disorder is on our minds, I wanted to share with you that you can look at Marsha Linehan's work. I can't think of it off the. Is it Linenehan? She is kind of like Jane Goodall. Kind of, think of that. She later shared that she herself suffers from borderline personality disorder. And because of her own psychological distress, she developed the system that made her successful. Like I say in the beginning, I wasn't fond of her techniques, as it seemed just kind of too simple. Sometimes you know how like Dr. Phil just gives you these 2-minute diagnoses over this whole show, and you're going, wait a minute. Now, kind of he did that when he was, if you guys can remember, when he was on Oprah. I really used to get frustrated when he would do that. And that's why I think he got his own show, and there's so much legwork that goes into each episode. They really go deep and really talk to the guests and have all of their experts and everything go in. So what looks like one quick assessment is not. That's kind of how unrealistic I felt that Marsha Linehan's way of DBT was being conveyed. And then when I found out that she herself had it, so she was coming from a point of insight and experience and how she felt that she learned how to live more comfortably by controlling her emotions in the way that her mind works, having borderline personality disorder. Had a whole new respect for her. DBT is something that can be used for anyone in any circumstance. So let's say, I mean, you could even bring it into the workplace. If there's a lot of people having continual disagreements and it's a high stress environment and whatnot, you could hire a psychologist who specializes in organizational psychology, human resources type, and look at what's going on and develop some very basic thought patterns from DBT to teach the group how to manage their conflicts better. It could be used in so many different circumstances like that. But to the person who is very distressed with their emotions, to use the skills that they develop and learn in DBT is very comforting to them if they remember the tools. And that's how they have to continually reevaluate and reassess in their mind that they are regulating their emotions and using the skills of DBT to get them through the next period of time. The borderline personality disorder itself is defined as an access to disorder that encompassed a number of different psychiatric symptoms. And it says it's a numerous comorbid axis 1 and axis 2. That's your basic, if you Google borderline personality disorder, it's going to give you that basic thing. And you're like, okay, well, what does that mean? Well, it means that because the DSM got revised, we can't break it down and say, this is how it lays out when we put together all areas of 5 and axis 1, 2, 3, 4, and 5, where you address the person's housing, their health, their diagnoses, their personality disorder, and their overall global function. All of that got thrown out, and now it's a little bit different. So to explain borderline personality disorder is a little bit more difficult. And as I said, I've been out of school for a little bit, and I don't have my books. I don't have my Marshall Linehan workbooks right here. It's always, you know how when you move and you always think there's that one box. You got to find that one box that has it. And I've gotten to most of my boxes. I don't know where that box is. So you go in and you do a basic Google. It's going to get you to ncbi.nlm.nih.gov. So that's going to be that National Institute of Health, and it's got good information on borderline personality disorder. So I would suggest just if you're bored, just do that. I know that we had some conversation the other night as people were talking about how one of the examples of borderline personality disorder is a person who has been familiar to many of us and has expressed that she suffers from borderline personality disorder. While many of us are witnessing what we know to be that of people who suffer from narcissistic personality disorder. And so people, because she said that she's one, if somebody says that she's another, then the two people argue back and forth, and it shouldn't be that. It should be understood that the actions of the person that gives us these readily available examples, is displaying many, many symptoms and characteristics of different personality disorders and biological, brain chemical disorder, things like bipolar, you would think of just off the top of your head. And you don't know if that is from substance abuse and alcohol abuse, and then the two combined currently and how they are being expressed by that person. And you don't know if there is long-term damage to that person's brain from the addiction spanning over 30 years. Basically, a person like that can only get better by having all areas of their life reassessed in long-term treatment. A person behaves very differently when they are under the influence of a substance or substances. So, like I say, I think that this, just just to keep up, if you guys are wondering, do that and go to this. I like this one where it's coming out of it's called PubMed Central, and it's going to tell you just your basics. So it's got here, one of the things that you might find the most interesting is if you go down and you find, I should have pulled this up on my internal camera. I'm sorry I didn't. I'm going to read the way that they put this. They put the focus on diagnosis through specific symptom assessment has also culminated in the current criteria for BPD, which were initially described in the DSM of Mental Disorders, third edition, published in 1980. The prior two versions of the DSM did not contain the diagnosis of BPD at all. The most recent criteria for the disorder, which are described in the DSM 4th edition text revision, DSM 4 TAC TR, are listed as followed. Okay. Little side note, did you know that even being gay was listed as a mental disorder prior to the revisions in? And don't even get me started on what they, how they addressed any gender confusion. Like I say, the DSM really had to be revised to show how our society is now. So, this states here, the criteria for the disorder is, and it has this list, and it says frantic efforts to avoid abandonment. Ding, 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 ding. We see that. A history of unstable and intense relationships with others. Ding, ding, ding. Identity disturbance. Ding, ding, ding. That's when maybe the example we're thinking uses the experience or says that she has jobs that she doesn't, but maybe the person that she was married to or is friends with has, confuses their details or uses their details to help amplify their story. But like I say, if I could highlight this thought right here in this frantic efforts to avoid abandonment, impulsivity in at least two functional areas such as, ready, spending, sex, substance use, eating, or driving, recurrent suicidal threats or behaviors, as well as self-mutilation, affective instability with marked reactivity of mood, and chronic feelings of emptiness, inappropriate and intense anger and difficulty controlling anger, and transient stress-induced paranoid ideation or severe dissociative symptoms. 5 of the preceding 9 criteria are required for diagnoses. Well, from the, I don't know, maybe the examples that we've seen recently, I think we can hit the 5 out of 9, if not 9 out of 9, right? So you go down and, there's just blah, 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 blah. More stuff about it. And then you go on and it just goes on and it talks about how the multiple psychiatric symptoms in BPD. Now, it talks about how the criteria in the diagnostic interview for borderlines includes a section on impulsivity, which explores multiple self-regulation and self-harm behaviors. And it says, finally, the contemporary DSM-4 TR criteria refer to impulsivity in at least 2 areas, suggesting the presence of multiple diverse symptoms. Okay, and then it says, however, is there any research data that support these impressions? Now, this is talking, essentially, if you were to look at this article, it gives you the background, and it says, so they've got a lot of empiric studies. They've got basically this would be like a final class because you'd be using all of the skills that you've gotten in different classes to read further down in the article. So if you go to this basic, it gives you a lot. I wanted to talk on how prevalent borderline is, but I'm not seeing that. But I thought that was, you guys would appreciate understanding how there's that really intense fear of abandonment, and you see that. Now, one of the examples that I would like to touch on is in people who suffer from borderline personality disorder. They have a very difficult time regulating their emotions. The female example that we may think of seems to go through her emotions quite fast and can go from one to the other, while the male version that might come to mind for an example of a person with a psychological disorder, I believe also conveys symptoms of borderline personality disorder, but it could be substances as well. The thing about him that I've not observed previously is how he hangs on to the anger. Once he gets to a point, he'll sit there kind of like looking like, like maybe there's some buzzing going on in the head. I guess buzz literally. But you know how like when a fly trap is just sitting there and it's just getting ready, and it gets a fly and it's like, zzz, zzz, zzz. It seems like that's what'll happen when he's sitting on the couch. And it'll be like, then he'll start zapping when somebody says something. And the only way you can say something is if you paid. So he has people monitoring his chat, and then when somebody pays to say something that goes to him, so he's got a gatekeeper that makes sure that he's given money, because it appears everything is transactional with him. So then they pay the money, ask him the question, or he will engage for that amount of money. When I've seen him start to rage, the person isn't even there. It's just they said something. He will rage and then rage. And then that rage goes to an exponential rage. And then he rages on that. And then he goes back to other things that have made him rage. And then he rages more. And it's really frightening to watch. it's something that you really don't see often, as people tend to not want to hold on to anger as it is an uncomfortable emotion. They like to use it for what is needed and then go back to a safer place where there's not such an intense feeling with the emotions. He appears to be unable to do that. And that's where I think that some of his past criminal charges, I don't know how many convictions he has, but it seems like those would be rooted in his inability to regulate those emotions. So, as I look at all of this and I say, how does any of this make sense? How does what we are seeing make sense as it pertains to our very modern world and the internet? How does mental illness on the internet, that's what I titled this one, on the internet. How does mental illness on the internet show itself, really? I mean, without going too deep, and I apologize if I have gone too deep, I'm trying to break it down because I'm overly educated and I don't mean to be boring. I'm trying to make this interesting. And it's hard to explain. Borderlines are very difficult because they have different characteristics from many other personality disorders. So when somebody is familiar with one and they have not seen somebody with borderline, they're not understanding how they're seeing the other. And I believe that there's so much overlap because you can't really separate them. Like I say, you can, the way it has been done in the past is that they'll give the primary diagnosis and they'll say with characteristics of that, with features of this, with whatever. And then, the question really was being posed is that how can a borderline be a sociopath is essentially the discussion we were having in the comments the other day. And I really appreciate when people give me food for thought like that and allow me to really, ponder with them, because there are people who right now will share their psychological issues online and make it appear that they are very officially talking. Meanwhile, they're talking about their experience. And it's difficult because people think of a sociopath as being cold and having no feeling. But then a borderline has extreme feelings. So then you have to split the two between empathy and sympathy. And then you put in insight. And you see somebody, for this example, loving on an animal. Oh, I need that animal. I need that animal. Meanwhile, kicking and closed-handed punching another animal, simultaneously loving one animal while punching the other. If you look at that, you see love and hate being expressed at exactly the same time. Is that splitting? I don't know. Is it all an act? Is it the substance abuse? I definitely think that the behavior we witness is something that a psychiatrist could sit in a cold, sterile office with a proverbial couch for an entire career and never once see. We are really, really witnessing a borderline in the wild, if you will. Um, Lines have the most difficult time with that emotion regulation. That's where I don't understand what I'm seeing when I see that love for one dog while abusing the other. I don't know what I'm witnessing when I see that. I would be frightened to know what happens when there are not cameras on this person that has been providing us with examples of a borderline. Now, what I want to express is that please remember that there is a spectrum. Everything's on a continuum. If you meet somebody and they share that they have borderline, please do not assume that they are going to act in the way that you are witnessing from somebody else. Um, the DBT, it's actually dialectical. I say diadectical for some reason. I don't know. I maybe think it's some kind of a dinosaur or something. I don't know. So the DBT is dialectical behavioral therapy. If you get bored, look it up. Look up DBT. As I say, it can provide very useful everyday coping techniques. And if you have a child, teenagers, that are struggling with certain things in their life, to know how to understand where they're coming from and kind of pull yourself back when you might be feeling really strongly about what they're doing and kind of talk your emotions down, it could help you to be a more effective parent. It may help your children to hear you, and it might help you to teach them those skills too, so that when the overwhelming feelings of being a teenager, especially in today's world with the internet, are too much and they may feel like unaliving themselves, to help them break down the emotions and help them regulate what they're feeling, you could help them too. So we can all use the category 5 shitstorm nutshell as a huge learning opportunity in our YouTube community. And if any of you take a psychology class in the future, especially abnormal psychology, you'll have food for thought. You'll write the best papers. They will just absolutely flow wonderfully. So the relationship between a client and a counselor with a person who has DBT is really helping them process emotions like anger and taking that distress tolerance and teaching skills. So when they're feeling distressed, how to have skills to minimize that distress. There's a lot of reading in our modern times on the HPA axis, and the way that the hypothalamus and the pituitary adrenal axis control the reactions to stress. As different body processes are regulated, such as digestion, the immune system, and your mood and sexuality and energy usage from those areas of the endocrine system. If the hypothalamus pituitary adrenal axis overreacts, then you get your things like diabetes and obesity and cardiovascular disease, which if it gives out too much cortisol, then that is what they are now implicating in mood disorders such as depression. And that's a huge, deeper school of thought from where we used to have just basic thinking that it was just in the way that our brains processed serotonin, that there were just very basic, this doesn't work, so let's do this. And I think that that's going to help people in the future to find out if they have underlying things. One another good example of some of this behavior is a person who, I don't think she has borderline, but it's been implied. She is very obese, and her boyfriend, caretaker, and her do a show. And I believe that there are some underlying issues here where that HPA axis AXIS is contributing to what we see that she may have underlying diabetes, just from obesity. But I think that, she's an asshole overall, but there could be some definite issues going on in the endocrine system. Whereas I don't really see that in the one that we think of when we're saying borderline. So when you are you're going through your day, and the factors that control your thoughts, like I'm a person who's in chronic pain. I have chronic pain disorder from a multitude of things that have happened. And so I have problems with my emotion regulation because I'm already dealing with that. I've got chronic pain. And then if I have a lack of sleep from not being able to sleep because of the pain, then I'm already on edge. So something could happen to me and I would react. Whereas the person next to me who's not in chronic pain and had a good night's sleep would have the same thing happen to them and they wouldn't react. Whereas I would. It's the same thing when you're looking at somebody with borderline. And if a person with borderline has these other factors, then they're going, and they've got that pattern of negative thoughts already on them. And then it gives them a bad attitude. So then if you go and you're a person and you had a great night's sleep, you're not in any pain, you get up and, everything's good. And even if you have borderline personality disorder and somebody cuts you off in traffic, it's not going to be that big of a deal because there are all of the factors that affect you. And if you have borderline personality disorder where you're more sensitive to those emotions, factors in how you are going to approach the day with positive thoughts or negative thoughts are ever changing, okay? So when you go to that basic DBT premise, the dialectical theory is that everything is interconnected. So where you being in pain is interconnected to that person just cutting you off in traffic. It's all interconnected. And that your reality is not static, that everything is ever changing from one moment to the next. And then there is the premise with the DBT thinking that there is a constantly evolving truth that can be found by synthesizing different points of view. There are many of these basic foundations with DBT. That is one of them. And so it's in order to go through that, you would be if you're a person with with borderline, and you are trying to have a good day without having your emotions overtake a situation or your day, your planned day, your activities that you want to get accomplished. You could be assessing yourself as much as you need to. Sometimes that's every minute, sometimes that's every 10 minutes, sometimes it's every couple of hours. But what you're going to be saying to yourself inside as you build this skill set, you're going to be saying, what am I feeling and how am I reacting? What am I feeling and how am I reacting? What information is coming at me right now? And remember that that is always changing. A really great interview that is clipped out of Marsha Linehan is she's doing an interview with a man, and he has borderline personality disorder, and he hits his wife. He's a domestic abuser, admittedly so. He identifies that behavior as equal to what his wife was doing because his wife was demeaning him. His wife was insulting him. His wife was hurting him. In his mind, his reality is she is hitting him. Even though she is not hitting him, she's saying things to hurt him. He doesn't have the same way of insulting her. He's not in the same playing field as her as it pertains to emotional abuse. So he sees hitting her in the same parallel. She hurts him, he hurts her. That's his reality. It was fascinating to me. As you know, that I do a lot of studying in the Watts case. It is my belief, based on the research that we have, that Christopher Watts's wife demeaned and insulted Chris. He could not understand or process that, and he could not and would not insult her. One night, did it all build up? He decided to hurt her. We don't know. But watching that interview made me wonder, as it made me see that there are people who see hitting the same as being insulted. When they are hurt in one way, they go to hurt in the other way. So they equal an opposite reaction. They don't see that they're doing something wrong. Well, one's going to get you arrested and the other isn't. They both hurt. And it would be up to Marsha Linehan to then break down with him how to better handle his emotions when he feels that he's been hurt, so that he does not hit her, which could lead to him being arrested, or hitting her so hard that there's no return, that maybe happened in the Watts case, is that something went too far. You don't ever want to resort to a physical fight. You always want to diffuse that because you don't know. what could happen. It was interesting to see this man say that to Marcia and her not react and in the way that maybe a classical therapist would, and talk to him about how bad that was. It was just interesting to see her look at him and ask him very basic questions. And it was, like I say, it was very insightful to me to see how one could see the other thing as the same. So, the skills training to a DBT person with the skills training to a person with borderline personality disorder are this constant DBT. And it'd be, what am I feeling? How am I reacting? What am I feeling? How am I reacting? What information is coming into me right now? Because it's always changing. You may see people with sometimes with therapy, one of the things is they'll put a rubber band on their wrist, and then every time they're having the negative thoughts, they snap their rubber band to make them stop thinking. It would be the same as somebody with a borderline personality having a little silicone bracelet with the two messages and one on one hand. Say, what am I feeling? How am I reacting? What am I feeling? How am I reacting? What am I feeling? How am I reacting? And it's that very simple, no extraneous information. As you've noticed with the person who we can think of as a good example of when that person is asked a question, it goes into all of this extraneous information about 17 different people, different places, claiming, making up things, talking about cities, food, places, and you never get that straight answer. That's a borderline. That borderline will sit there and take you all around the block 17 times before they give you a direct answer. It's all the deflection and whatnot. And so, knowing that they're borderline, many of them need to be in extensive, intensive treatment facilities, homes, etc., or their loved one would know how to redirect them and ask them a question. And if they start, going all over and talking about this and playing the victim in this and turning it into this and spinning themselves up and reminding them, what are you feeling? Well, how are you reacting? What are you feeling? How are you reacting? What information is taken in? There's very direct. You have to get them to be very, very succinct and direct about what are they feeling and how are they reacting. And I think that's what people need to understand, is that they're not helping people like this that display this behavior. They're not helping them by giving them a group of people that then fights amongst them and creates more negativity and more negative emotion and feeds into that. It only creates more static in the already confused brain that is that of a borderline that's out of control and using substances and drinking alcohol. So back to those foundational assumptions with DBT. They're very basic, and they are as follows. The clients need clients need to work harder, or clients need to work smarter, and they need to be motivated to change. So if the person who we're thinking about is truly dedicated to getting back into psychological treatment for the mental disorder, maybe taking medication for a possible bipolar issue. Medication cannot help a personality disorder. Therapy can. Therapy can also help a biological disorder such as bipolar and whatnot. So you can have the therapy that can work on both. The medication can work on one. And you need to remain away from any substance, alcohol, pills, etc. So you need to get all the way sober, all the way detoxed, and then go back to psychological treatment and relearning the skills of DBT. Very long term, 18 to 24 months minimum, and then possibly in a group home setting or a sober home facility would be very appropriate. Because as it is with the belief with the counselor and the person receiving the treatment, patient, if you will, the client and the provider, that the client needs to work for this. The client has to be motivated to change. If the client is not willing to work and they don't want to change, they are not ready to understand how to use the skills of dialectical behavioral treatment. It won't work. Now, in the basic assumptions of that, it is the basic assumption that people do their best. It is the basic assumption that people want to get better and people want to be happy. And it is the basic assumption that even if people didn't create their problems, they still have to solve them. So, let's say that the ex-spouse of the person who might be on our minds, if he is out there and he's having a very difficult time, his finances are a mess, his emotions are out of control, he can't get into another relationship until he works on himself. So it would be up to him to solve the problems in finding skills that he can do to manage his emotions with it, even if he didn't create the problem. People who came from abusive families, like in mine, many generations of abuse, that I took a stand and I stopped the generations and generations of abuse and addiction in my generation. I stopped it. It will not continue. I stopped it in my generation. So although I didn't create what had happened generations ago and continued, I didn't play the victim like my mother, my sister. I solved it by being sober and present my children, so that then they were not affected by abuse, substance abuse. They got to be children and have a childhood so they could do well in their education and go out and raise happy children to bring back to me so I can love them. Little 2.0s. So that's where it goes, is even if you didn't create it, if it's affecting you, you have to solve it. You can't lay down in victimhood and say, well, I'm this way because of this, and I'm this way because this, and I'm this way because this, and well, I can't do anything because of that, and it's your fault, and no. If it's affecting you, you have to solve it. It's that clear, and then that concise. How are you feeling? How are you reacting? And we go to the next premise. that the lives of suicidal or addicted people are unbearable. Again, the lives of suicidal or addicted people are unbearable. That if you have unbearable emotions, you feel suicidal or you become addicted to a substance. When you have unbearable emotions, one or the other occurs in a person that cannot bear those emotions. Is the example in me that I have provided? When my emotions were unbearable as the pain of all of the generations of abuse that I had endured, and they affected me because I had not stopped to take time to get treatment for myself, for all of the abuse that I had endured. Those emotions were unbearable, and I became suicidal, okay? I had to solve that problem to come back to and participate in my life. The next premise is that people need to learn how to live skillfully in all areas of their lives. The next basic premise is that people cannot fail in their treatment. Those are your basic DBT assumptions. That your clients need to work harder or smarter, and they have to be motivated to change. That people do their best, that people want to get better because they want to be happy. Even if people did not create their problems, they still must solve them. The lives of suicidal or addicted people are unbearable. And that people need to learn how to live skillfully in all areas of their lives, and people cannot fail in treatment. That's your basic premise of DBT. Now, it goes into really looking at how the emotions are affected in one area can overflow to the other. And then looking at the choices in why you chose the good behavior and then why you chose the bad behavior if you did. So are you looking at how you're feeling and how you're reacting? And are you happy with the choices? Are you making good choices? And if not, you went into old behaviors, you went and you used, you relapsed. Why did you choose that behavior? And you have to ask the person, why did you choose that behavior? And in a person like we can think of, I think that it would take a very, very talented therapist to get these concepts through to this person, as it seems to me that this person lacks insight. It seems that even if that borderline diagnosis that she purports she has, even if that is the true diagnosis, that even given that this is the best shot at therapy, this is what works for borderlines who want to get better, it would be tough for her from what I have seen her display. Now, I believe that there may have been something missed in that diagnosis, because the animal abuse is problematic to me. The child abuse is problematic to me. There's borderlines are more hell-bent on hurting themselves than others, from what I have seen. So that's where I am not a therapist. I don't know what one could do. It would be very difficult and complex, but as I say, since the term has been brought out and has brought up a lot of discussion, there's not a lot of research out there about borderline, that there's a lot of people who are borderline that are probably very frustrated, because it's hard to find a provider that does DBT. I think that there's an amazing creator where I think she has the best information out there, is Doc Snipes, DOCSNIPES. I think that she is the absolute best resource for both people suffering from borderline and providers who struggle with their complex, disordered borderlines. I think Doc Snipes is the best. It's DOC Snipes, SNIPES. Doc Snipes, amazing, amazing. I can't say enough about her. I wish that she would have been there when I had my freaking nervous breakdown. I would have really liked her. I like her now. I'm saying that I would have really liked her to have given me treatment, because I think she's great. So it's the discipline involved with treating somebody with borderline, and the discipline required of the patient, that I don't know is available to the person who may be an example that we're thinking of. Looking through my notes here. Wanted to bring up something else, because as I think about this, and I think so. Sorry, I'm thinking about how to go to the next. Oh, wait. How do I explain this? Okay. In what I just said, with those basic premises, you can say that people will choose the most rewarding option. How do you explain her reward system versus the person who gives her the money? It's what I'm having a hard time explaining. My theory here, I feel that, okay, I feel that the person who we're thinking of panics because she's not going to be able to get her next fix right now. The only thing she has right now in her life is the drugs. If the drugs aren't there, she's going to be able to feel that abandonment. Or essentially, if the drugs aren't there, that's abandonment in and of itself. So it goes to the money, the money, the money, the attention. So the overwhelming emotion, afraid she's not going to have money to buy the drugs that are going to cover the feelings of abandonment. So she begs and begs and begs. Whines and whines and whines. I feel that causes distress in the viewer. The viewers believe that they have a relationship with her, and they feel distressed because they're just regular people who may not be dealing with a full deck, or they are lonely too, and they see her as their friend, and they feel that if they give her money, they'll see her react and be happy, almost like a circus animal performing. You know, she'll do her little act of crying and whining for money, and then they'll give some money, and then she'll do a little dance. Everybody's happy. The person who was feeling sorry for her and feeling distress gave her a little bit of money. They feel the relief. She's got what she wanted, which is all important to her, and it's relief, and then there's relief felt on both parts. That's the only way I can see that this is making any sense, other than to just basically say she's an addict trying to get her next fix and she's begging, and this is a lot more convenient than going out on the street or working for time for pay. Anyway. So the borderline is highly emotionally reactive, okay? They're either suicidal or they're addicted. They're the self-harm or they're the self-sabotage with the addiction, because you can say that the drugs are a slow kill, right? And it seems that in the situation where I'm trying to describe it, I think that relief is providing that instant gratification for both. Now I go further and I'm going, what is her thrill with the doxing? I think it's a control thing. I think that when there's somebody out there that dares to try to hold her accountable by simply questioning the obvious lie that she thinks is her reality, she sees them as attacking her. Kind of like where I'm saying that the man in the situation with Marshall Linehan doesn't understand that his hitting is not the same as her calling him a name. One's emotional abuse, one is physical abuse. If you dare to question her, that threatens the person giving the Cash App being able to think about the fact that they have the option to walk away and not give the Cash App, that in fact that Cash App may be giving her something that could cause her her own harm or unaliving, or cause her to drive and harm innocent people. So the person who does not give her what she wants is providing this challenge to her. And she doesn't have any other way to respond to it. So what's she going to say? Oh, you're right. So she thinks that if she finds out who you are, then she can get control of you by finding out your phone number, your address, and then calling you and your family and acting as terrible and obnoxious as she possibly can until you go away because that is what works for her. And it goes down to her deep-seated fear of abandonment. Is that a person who fears abandonment creates it, that they essentially do not believe that you're not going to leave them. So they will sabotage the relationship and act like a terrible, out of control 2-year-old until you do leave them, because they knew it was going to happen. So then when you do leave them, then they say they were right, and they have that feeling that they were once again in control because they did not let themselves be vulnerable, because they knew that you would leave them, as they feared, as they caused. I think that people, they always say hurt people hurt people. And the reason that I did the open letter that I did today is because I understand that concept more than anybody, that hurt people hurt people. But I also understand that that is no excuse. And as to the basic premise in which I am talking about, in which with her diagnosis, she has been informed that it doesn't matter if you are a hurt people, you don't hurt people, that you need to figure out how to solve this, and you need to figure out how to control your emotions, because it doesn't matter if you caused it or not. The fact that it is affecting you and your interpersonal relationships means that you need to solve it. And by you solving it, it means that you need to control your emotions so that your emotions are not so out of control that they are overbearing, which cause you to feel suicidal or addicted, which means that you are going to self-harm or fall off the wagon, as they say. Relapse. Emotional regulation is the name of the game. As emotional dysregulation is at the very source of it. I feel that she was trying so hard to get the other person in with her. And I hope that he's not going to. I do believe that there are active warrants out for his upcoming trial. So I think that there is a bench warrant. Because with her out of control emotions and his inability to self-soothe, they really would not do well in each other's company, if you will. So, I mean, that's kind of where my thought process is going on this. Do you guys think about it too? Or do you guys just watch this shit show and go? I saw something, and I want to, really state that people think that the people who are speaking on the example and others, they're like, well, what are you going to do if those people go away? Then you don't have any content. No, 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 no. We creators are what are the platform. We are the YouTube streets. Right now, people are distracted because they're looking at the train wrecks off to the side of the YouTube streets. Because what do? When you're on the road just fine and everything's operating great and everything's smooth. Then there's a train wreck. Well, everybody stops and they have to rubberneck and look and oh my goodness, oh no. And then what happens because everything's all broken over there and those people need help? Well, you run to go and help them. And what do you do? And they're like, oh no, I'm hungry. I need this. I need that. Well, what do? You give them money. And then you forget about the people who are just there waiting for you to come back and get back on the road. So it's not like I say it's not that at all that people aren't going to have any content. The content's there. The other, I mean, I think that this is an hour and 15 minutes of therapy on the internet for y'all. Um, I think that I'm going to stop there. I'm going to stop there so I don't overwhelm you guys in my next train of thought on that. Because I got to figure this all out. So thank you for listening. There is so much more to say on this. And I thank you for listening. I thank you all who have joined. This is a community that is really cool because, like I say, I don't even need mods. When I go live, nobody fights. Everybody gets along just fine. A couple of people say, things to me and whatnot, and I, I just, ignore it and delete it. And when it's on for too long and you guys see it, you guys are awesome and you guys chew them up. You guys are great, and I love you all. And really realized about 3 months into this that I have this group forming of amazing truth seekers with me. We are all just people who wonder, and we're like, hey, that doesn't look true. And if it's not true, it's not right. And there's a bigger picture about making sure that the truth and the facts are known before anybody goes from this side to that side. That together we can find the truth, and then we have a better understanding of each other. And it doesn't mean that one person is right or wrong. It means that there's something more. And if we bring our collective backgrounds together and our experiences and we talk, we can really create a better world for our children and our legacy. And that's what it's all about. And again, thank you for understanding that this is more of a listening channel. I might get some skills at some point. If anybody can put, in the chat or email me, what software do you guys use to do nice, pretty videos? Because I don't know. I don't know anything about this. So thank you so much. And remember, it's not in the black and the white that sell the headlines. The story is told in between. The story is where the black and the white mix and creates the gray. And that is because gray matter is what your brain is. So here's your brain that came out of what was there in that black and white. Go in the middle of it. Do your own research. Find your own facts. Be able to talk about why you think a certain way. And you'll be a better person for it. I'm telling you. I'm telling you. So thanks so much for listening. I will talk at y'all soon. Thanks. Bye-bye.